to present a topic in front of my teachers and friends. I'm so glad and honored. So, coming to my topic, dentistry has been changing nowadays from conventional technique to aesthetic consideration. While we are considering aesthetic, cosmetic dentistry has been developing day by day, and clinics and hospitals has been more focused on this cosmetic dentistry. It's because most of the people are being concerned about their aesthetics nowadays. While considering the white teeth, as we all know, white teeth has been considered to be having a higher scope of social competence, intellectual ability, psychological balance, and social status, and may impact the quality of life of a person. While we are coming to the life of adolescents, they may focus on their facial attractiveness. And this facial, in considering the facial attractiveness, dental appearance is considered to be as the best, being the first factor. They will be related to their attractiveness. That's why they are more focused on their orthodontic treatment. And also, while I am taking the topic about Resin Infiltrate, that is an icon which is more focused on treatment of white spot lesions. And as we are looking for the cause for this white spot lesion, it's mainly occurs due to fixed orthodontic therapy. Because of its increased risk of poor oral hygiene, or the patients are not able to clean their oral cavity properly. There is increased risk of demineralization in their patient, and they will develop a white opaque appearance on their tooth surface after the orthodontic treatment. That's main cause for the white spot lesion, and for that white spot lesion, we are more focusing the icon for the treatment of these white spot lesions. So, as we are looking for the indications for Resin Infiltrate, it includes white spot lesions, fluorosis, incipient caries, and hypoplasia. And coming to fluorosis, I am adding these fluorosis and hypoplasia in sake of adding the slides. As we all know, this fluorosis, and fluorosis appears mild condition. Appears as a white spot on the incisal edge initially. A molted appearance on the enamel will be appears. Later, yellowish discoloration, and finally it will be led to a pitted appearance over the tooth surface. And yes, enamel hyperplasia, it occurs as an incomplete or defective formation of organic enamel matrix of the teeth, and it's also having a mild, moderate, and severe conditions. And this is different forms, that is hyperplasia has been occurs over the tooth, that is due to Danus hyperplasia or a single tooth, or due to hypocalcium conditions, syphilitic hyperplasia, or different types of hyperplasia has been there. And as we come into later, earlier I said about the white spot lesions, and this defined as the surface, enamel surface or surface demineralization without any cavitations. Mainly, I spoke about earlier, about 46 to 73% of cases in fixed orthodontic treatment, this white spot lesions will be appears. It appears to be as in this picture, it will be around the brackets. There should be a white opaque appearances over the tooth surface will be occurs. It will be a predisposing factors for developing caries because of its demineralization of the enamel as well. And as we are considering the conventional treatment for this procedure, mainly this focused on resin restoration with a composite restoration, a composite material, or whitey bleaching procedure. Porcelain crown can be occurs, and porcelain veneer can be given. But in these techniques, the most common disadvantages of this technique is that it will causes loss of healthy tooth structures. There is no preservation of tooth structures has been occurs in this conventional treatment procedures. So, that's why we are using a resin infiltrate technique. In case of resin infiltrate technique, it's mainly there is the treatment, that is we are given the treatment without removing the tooth structures. And also resin infiltrate technique will be alter the process of both incipient lesions as well as white spot lesions. It can also cause used effectively in appropriate situation, either in proximal as well as in a smooth surface lesions. And as I spoke earlier, the advantages over the conventional method. The most and foremost important point is that it includes the preservation of tooth structures. As in case of veneer and veneer, there is a loss of tooth structure will be occurs. But in cases of resin infiltrate, there is no loss of tooth structures. In addition to that, it's a painless procedure. The anesthesia has been required, and also it's a cosmetic procedure, that is treatment we have been done in a single visit. And has in cases of patient that is having a high patient acceptance will be occurs for this procedure. And has coming to icon, it's a brand name which has been given by Dental Milestone Guaranteed Company, which are they marketed, the resin infiltrate has been marketed under the name Icon, and it's consisting of a pack of 3, and which contain an Icon etchant, Icon dry, and Icon infiltrate. As I will explain it later on techniques. In technique, first one is the Icon etching. As Icon etching, it contains about 50% of hydrochloric acid. And this Icon etchant will be applied over the tooth surface about 2 minutes. In between the tooth surface, 2 minutes, we have been steering over the tooth surface time to time. And as we are considering the advantages of this hydrochloric acid for beyond the phosphoric acid is that it having a higher penetration ability. That is, it produces about 15 microns of penetrability than the phosphoric acid, which is only given only 25 microns. And which also the purpose of this Icon etchant is that it eliminate eroded the lesion, surface of the lesions will be eroded, and also eliminate the decalcified areas and prevent further attack of the lesion. And this is the surface preoperative conditions of the preoperative condition, and it's been isolated with the rubber dam. And after that, Icon etchant will be polishing of the surface. Icon etchant will be applied over the tooth surface, and after that, Icon dry will be applied. This Icon dry consisting of 99% of ethanol. Because of this high concentration of ethanol has been given, it slowly replaces the water content that is present within the demineralized collagen matrix, and later it increases the penetrability of the resin infiltrate. So, and also as we are giving this Icon dry, it increases the capillary actions of this resin infiltrate to get into the tooth surface. And after Icon dry has been applied over the tooth surface, and later an Icon infiltrate will be applied. And Icon infiltrate is a resin material which includes tetraethylene glycol dimethylate is applied over the lesion is using a micro brush. And after applying the material on the dosa, excess of the materials will be removed. And after the excess of the materials will be removed, it will be light cured for about 40 seconds. And after the application of Icon infiltrate, later one more coat has been applied over the tooth surface, and it is also been light cured. It's because this double application of this resin is because of the fact that first when you apply this resin infiltrate over the tooth surface, first there is polymerization generation will be occurs over the tooth surface, and there is space will be created. So when we apply the resin for the second time, this space will be closed. And after the resin infiltrate will be applied, the surface will be excess of the materials will be removed and will be polished. And this is the post-operative condition that has been applied. First picture is the immediate post-operative condition, and second one is the 2 weeks follow-up. And I have a video of the of the cases that is given by the DMG icon report. And this first case is it's also of exfoliation condition, and this one too, and this one is also of exfoliation, and it's conditions of fluorosis condition. So as we consider the limitations of this icon, every product is having a disadvantages. So in cases of an icon material, it's mainly a time-consuming procedure. Plus, it's consisting of 50% of hydrochloric acid as an agent, so it can irritate the soft tissue. Proper isolation of the tooth and proper protection for the soft tissue is very required, and also it depends upon the depth of the lesion. As a conclusion, cosmetic and aesthetics are current trends of dental dentistry, as well as patients are demanding mainly for the minimally invasive cosmetic infiltration enhancement without any anesthesia and relief. The technique of resin infiltrate may be considered as a micro-invasive treatment of smooth white spot lesion, and also allow for the recovery of natural tooth appearance. And also resin infiltrate technique is considered to be a micro-invasive and might bridge the gap between non-invasive and micro-invasive treatment of initial dental caries, postponing as long as the need for the restoration.